Osar with Fitness Education Seminars and developer of the Integrated Movement Systems. Welcome to this edition of Fitness Insider. In this video we're going to talk a little bit about hip, knee, ankle, foot centration and what patterns are most effective to do with your clients. Because I had recently had a patient who came to me after seeing a personal trainer for the first time, and she's 2 months post rehab. So you're going to get clients that want to start working with you as a fitness professional that are just coming out of rehab or off an injury. This client went to this trainer, and one of the first exercises he did with her for her lower body, this is 2 months after a meniscus surgery, is a Bosu lunge. This client could barely stand on one leg and was stable on one leg. So she had difficulty just stabilizing standing on one leg. So there's no way, especially 2 months post-rehab, that she should have been on a Bosu. So the important point here, and what we try to make at Fitness Insider here, is we must develop optimal centration first before we progress clients to unstable surfaces. So one thing this trainer did not do was he didn't even ask her about what rehab exercises she was currently doing and at what point she was in her rehab state, and didn't really talk to her at all about her surgery. So he wasn't even informed enough to make a proper decision to train her right. So I want to show you what to look for when you have a client that comes to you, just some quick assessments that you can do with your client to see if they're ready to do more advanced patterns. First thing we want to assess on all our clients that come to us for our specialty and our expertise is, can they stabilize on one leg? So what I want Ellen to do is shift her weight so she's standing on her right side. She brings her knee up to 90 degrees, all the way up, a little bit higher, and to see, can she get long through her spine? Can she centrate the hip, knee, ankle, and foot complex? So you see she's got a little bit of shaking, a little bit of rotation here. She has a challenge getting long, so I got to be real careful and cue her well through her patterns so that she doesn't develop a poor strategy in her single leg stance and or through her lower extremity patterns. You can put that leg back down. So the first pattern I work with clients on, once I teach them how to squat and do a split squat, is I'll have them do a step back lunge. And this will show you how they transition onto one leg and how they load this front hip. So we're going to look at her right leg again. So I'm going to have you step back into a reverse lunge position here. So go ahead and then just stop for a second. Okay? And what I want to see as she comes back into this reverse lunge is that her pelvis is level. So she's got to square that pelvis up. Clients will usually drop down and out like that. They lose that glute medius and that lower glute max function. So she's got to be able to stabilize here. They'll also lose the trunk position, so I got to make sure that they stay activated through the trunk and spine. They'll also lose that knee position. You'll see the knee often dive in. So I want her to activate her deep rotators to get that centration of the ankle, foot, knee, and hip complex. Come back up, and I'll do that again. And try to keep that alignment so she stays activated, stays level, stays long through her spine, and keeps that centration through her hip, knee, ankle, and foot. And come back up. The next pattern I'll look at is the forward lunge. How do you transition from the stationary position to a forward lunge position? So step back a little bit, Ellen. Now I want her to step forward, and then come back, and then do this right side, please. And come back, and do it again, and come back, and one more time, and then just stop right there. And I want her to, again, stay level, stay long through her spine, stay activated through her core. I want her to be able to centrate and sit back through this hip so she's not using her TFL rectus femoris, which drives, again, her pelvis forward and into some internal rotation here. So she stays level here, square to that wall in front of her, and she stays centrated through the hip, knee, ankle, and foot. Come back and relax. So again, anytime we have a new client or even an existing client, especially when they're post-rehab, we need to ensure they can get long through the spine, stay level through their pelvis, and be able to centrate the hip, the knee, the ankle, and foot. We don't want to see any deviations side. We don't want to see any rotations, and we don't want to see any caving in of the knee and or down here at the foot tripod. I hope this served you. This is Dr. Evan Osar with Fitness Education Seminars. Have a great day.